Okay, now this is the transverse section of, this is the coronal, section of the abdominal wall, and this is the anterior substance, anterior area. So you can see the rectus sheet. This is the rectus abdominis muscle, which is enclosed by anterior and posterior rectus sheet. So this is the arcuate line. Okay, umbilicus and symphysis pubis. In between umbilicus and symphysis pubis there is a imaginary line. It is called the arcuate line. Okay, so this is the rectus abdominis muscles. So this is the tendinous intersection. Okay, we can see there is some white area present in the rectus abdominis. This is a tall, flat, slip-like muscles. Okay, tall, flat, slip-like muscle. But this tendinous intersection makes the muscle intersegmented. So this is the segment, this is a segment. So why this tendinous intersection present? This tendinous intersection makes the tall muscle into short segments so that it can contract strongly and perfectly. It will allow abdomen to expand because there is no deep fascia, so abdomen has to be expanded and collapsed. Because when we hungry or when there is a gap, so there is a gap into the abdominal cavity, so there are many viscera, those are dilated, so it need extra space. So as there is no deep fascia, so this muscle helps in expansion, and it also gives extra protection from the external injury or blunt trauma. Okay, now if we remove the rectus sheet, so you can see here the posterior wall of the rectus sheet. So here above the posterior rectus sheet you can see blood vessels. That is, this is the inferior epigastric artery. Okay, so this is the inferior epigastric artery that goes lateral to medial, just below the umbilicus. It is reunited with the superior epigastric artery. This is the superior epigastric artery, this is the inferior epigastric artery. So these two arteries are reunited in the under the umbilicus. So in which layer the inferior epigastric artery present? It is sometimes asked. Okay, the inferior epigastric artery present in just below the rectus abdominis muscles. Okay, from anteriorly or posteriorly, which you can see this is the fascia transversalis in the blue area. So it pierces the fascia transversalis. So the inferior epigastric artery present in the extraperitoneal tissue and fascia transversalis. So where it present, in which two layers? That is extraperitoneal tissue and the fascia transversalis. Okay, so it presents in between 7 and 6 layers. That is number 7 layer is extraperitoneal tissue, number 6 layer is fascia transversalis. So inferior epigastric artery present in between fascia transversalis and extraperitoneal tissue. Okay, now inferior epigastric artery is the branch of which great vessels? It is sometimes asked. That inferior epigastric artery is the branch of external iliac artery. Okay, so then again there is another question: what are the other branch of external iliac? That is deep circumflex iliac artery and the inferior epigastric artery. This two artery is the branch of external iliac. So external iliac has two branch, that inferior epigastric artery and the deep circumflex iliac artery. Okay, now it has also correspond vein, inferior epigastric vein. Okay, it is a vessels, because I already show you the artery only. Okay, so now just focus here. You can see in inferiorly, so it is the arcuate line, it is a coronal section, like from left side or right side, how it look like. This is the xiphoid process, this is the symphysis pubis. Okay, and this is the umbilicus. So this is the anterior abdominal wall, so that means here the skin, subcutaneous and others. This is the rectus abdominis muscles. So below the rectus abdominis there is a vascular plane. So you can see here is an area. Okay, so this is the posterior layer of rectus sheath, this is the anterior layer of rectus sheath. So just below the rectus abdominis muscle there is a vascular plane. It is the inferior epigastric artery, which is correspond just below the umbilicus, and which is correspond with another superior epigastric artery. And you can see here there is a devoid of posterior rectus sheath. I already mentioned you that below the arcuate line there is no posterior rectus sheath, there is no muscular plane of posterior rectus sheath. Okay, so just below the arcuate line there is only fascia transversalis. I already showed you that there is no muscular aponeurosis, only fascia transversalis. You can review that part of the video also. So this is the fascia transversalis. So inferior epigastric artery pierces the fascia transversalis and goes to the goes under the rectus abdominis muscles. So you can see this is the fascia transversalis, and artery is piercing or penetrate the fascia transversalis layers and goes to the umbilical region. So this is all, but you can already, if you study that chapters, you can also see that is superficial epigastric artery. So there is a three artery: superior epigastric artery, superficial epigastric artery, and inferior epigastric artery. I told you that inferior epigastric artery are connected with the superior epigastric artery, but there is another artery that is called superficial epigastric artery. So then student asked me, sir, where it is present? So we are confusing about superior and superficial. Okay, superficial means it lies superior or external to the abdominal wall. That means superficial epigastric artery present in the fascia of Camper's, that is subcutaneous tissue. So it can be visible from outside. So a muscular man or a man of six pack, we can see that superficial epigastric artery can be seen from the externally. So we can see superficial epigastric artery from outside. So in which place it is found? That is fascia of Camper's or superficial fatty layers. So superficial epigastric artery present in the superficial fatty layers, that means the fascia of Camper's. So I hope it will not be mistaken later on. And superficial epigastric artery is a branch of femoral artery. Okay, so inferior epigastric artery is a branch of external iliac artery, and the superficial epigastric artery is the branch of femoral artery. So then the teacher will ask you, what are the other branch of femoral artery? So there are another two branches of femoral artery, that is superficial external pudendal artery, then superficial circumflex iliac artery, and this superficial epigastric artery. So in the femoral artery there are three branches. One is called superficial epigastric artery, superficial circumflex iliac artery, and the superficial external pudendal artery. So you must remember the three name of the superficial epigastric artery. Okay, and what is the branch of superior epigastric artery? It is the continuation of the internal thoracic artery. Okay, so you did know the branches of these arteries, because it is something asked in the exam, that is superior epigastric artery is the continuation of the internal thoracic artery. Now that is all about the general basics of anterior abdominal wall. Now we will discuss about hernia or the defect of various defects of the abdominal wall in the next video. Thanks for watching the video. If you like my channel, please subscribe and like, so that you can encourage me, you can have the next videos as well. Thank you very much.